How's it going, everybody? My name is Chris Franchina. I'm one of the co-founders here at Policy Engineer, and I want to give you a huge welcome to our Medicare 101. This is Understanding Medicare in 2025. Before we get into talking about Medicare itself, I want to tell you a little bit about Policy Engineer and who we are as a company. So if I were to sum Policy Engineer up into one sentence, what I would tell you, we're an insurance agency here that leverages technology in order to simplify the insurance planning process. And that's our goal here today. We want to simplify Medicare for you guys. I know it can be a complex system. They use letters to categorize the parts. They use letters to categorize some of the plans, but we're going to make the alphabet soup make sense today. All right, so what are some of the things that set Policy Engineer apart from our competition? One would be our technology. And you're going to hear me bring up the technology a few times as we go through the presentation today, but specifically in regard to Medicare, what we can do with the tools we use, well, we can pre-predict the cost of your medications ahead of time before you ever enroll into a plan. If there's a primary care physician or specialist it's important you have access to, then we can make sure they're in network before you enroll into the plan. And lastly, if there's any areas of coverage that original Medicare does not cover but are important to you, we can make sure to find those areas of coverage in a matter of seconds using the tools that we have access to here at Policy Engineer. All right, now the second thing I want to point out is our process. If you're hearing me talk about this technology and you're a do-it-yourselfer, well, guess what? You can have access to this technology. You can quote, even enroll into a plan at your own leisure, or you can work with any of our licensed insurance agents here at Policy Engineer, and they can take you through the entire process from A to Z, so you can be hands-off. And now one more thing I want to point out is our promise. We know your life's needs are going to change over time. It's never fun to call into the insurance companies to make simple changes, things like changing your address on file, changing your banking information. Maybe you got a bill in the mail you don't quite recognize. We have a Southern California-based client success team here at Policy Engineer that can take care of those tasks for you. We'll call the insurance carriers on your behalf. We'll get those small tasks taken care of. So again, you can be hands-off. You just let us know what you need and we'll take care of it for you. All right, so now you learned who we are here at Policy Engineer, but now I want to introduce you to what we call our method. What you're seeing on the screen over here is the stable table. You can see the car, the family, the dog, the house. They're all on top of the stable table. And like any table, you need at least 3 legs to have a table stand. So we believe there is a 3-pillar process to your planning for your lifestyle. That would be health, wealth, and legacy. These are all legs that hold up your lifestyle table. So let's take a look at this. One of the legs would be health. That's going to be Medicare. That's today's conversation. We're going to break down the Medicare system. A part of health planning is also looking at what Medicare and traditional health insurance do not cover. Things like long-term care or post-hospitalization care like custodial care. The second thing is wealth. That's another leg on the table. Bridging the gap between what Medicare covers and what it does not cover. And 85, probably 90% of the clients we work with are in 2 stages of life. You're either building towards retirement or you're already in retirement. But in either stage, it is equally important to focus on 2 things. One is preserving the assets you work so hard to save over your working years, and the other is maximizing your income in retirement. And that might be something as simple as finding the best age to start drawing Social Security. That's part of our wealth planning. And the last thing I want to point out is legacy. So we do specialize in life insurance here at Policy Engineer, and we also have access to a team of estate planners that do free consultations for trusts and wills. That is not done through Policy Engineer, but we have great partnerships and relationships here. So if that is a service that you can take advantage of, please let us know. We're more than happy to point you in the right direction. All right, so now let's get into talking about Medicare. We're going to start with the very basics of the system, and we'll get a little more complex as we go. But we're going to start with who is eligible for Medicare. Well, if you're 65 or older, you're eligible for Medicare. However, you can also qualify early due to a disability. If you've been receiving Social Security disability insurance payments for more than 24 months, that's 2 years, you're eligible for Medicare. If you have an illness such as end-stage renal disease or ALS, you're eligible for Medicare. And you do need to be a U.S. citizen or a permanent resident for 5 consecutive years to be eligible for Medicare. So now this page is very important. If you are 64 and you're aging into Medicare for the first time, we're going to talk to you about how to get into the Medicare system, how to enroll yourself. But let's first focus on the top half of the screen. The top half of the screen is for anyone that is currently receiving Social Security income and you're aging into Medicare for the first time. Your entry into Medicare is going to be fairly easy. I'm going to read this paragraph directly off of the Social Security website, which is ssa.gov. If you have Social Security when you turn 65, you do not need to sign up for Medicare. You'll be automatically enrolled into Original Medicare Parts A and B, which is your hospital and your medical, when you become eligible. Because you must pay a premium for your Part B coverage, you can turn it down. However, if you decide to sign up for Part B later, your coverage can be delayed and you may have to pay a late enrollment penalty for as long as you have Part B coverage. Residents of Puerto Rico or foreign countries will not automatically receive Part B. They must elect this benefit. And again, you guys, that is directly off of the Social Security website, and that is for people that have Social Security income currently going on to Medicare for the first time. But now let's focus on the bottom half of the screen here. This is for anyone that is not receiving Social Security yet. Maybe you're waiting until your full retirement age, maybe you're even deferring it until age 70, and you're going to get the highest income possible from Social Security. So there's 3 ways you can get yourself enrolled into Medicare. The first option would be applying online through the Social Security website, which is ssa.gov. Now, contrary to popular belief, you can sign up for Medicare on the Social Security website without signing up for Social Security also. There's a portion on the website where you can just sign up for Medicare alone without starting your Social Security. All right, so applying online is the easiest way to do it. The other option, you can call into Social Security. The number is 1-800-772-1213, and you can call and request an application. Now, here's a tip. If you're on the West Coast and you're calling Social Security for any reason at all, try calling later in the day. You're going to eliminate a lot of the East Coast callers, and the wait times are going to be shorter. Now let's go to the third option. You can apply in person at your local Social Security office. But here's another tip. If you go in person to Social Security for any reason, try to call ahead of time, schedule an appointment before you go in there. It can be very similar to the DMV. We all know how the DMV is. So these are your 3 options: apply online, call Social Security, or apply at your local Social Security office. Now we're going to look at the 4 parts of Medicare. This is going to be the helicopter's point of view of the Medicare system. Typically can be one of the more complex views of Medicare because they do use letters to categorize the plans, and they use letters to categorize some of the parts to Medicare. So we're going to break this down and make it easy for you guys. Okay, so let's break what you're seeing on the screen into 2 parts. First, I want everybody to focus their attention on the top half of the screen that says Original Medicare. That consists of Part A, which is your hospital insurance, and Part B, which is your medical insurance. Now, as long as you've worked 40 quarters in the US, you're going to have Part A of Medicare at 0 monthly premium. Now, 40 quarters is 10 years, so you'll have that at 0 monthly premium. Now let's talk about Part B of Medicare. Part B is your medical insurance. It covers you for 80% of your medical expenses in the hospital or in the doctor's office. Most commonly used part of Medicare. Now, Part B of Medicare also has a monthly premium, and that monthly premium is based off of your income. They're going to look at your tax return 2 years prior, and we're going to take a look at the chart for 2025 here in just a moment. So you have the first 2 here, Part A, hospital, Part B, your medical. 80% of your medical is covered by Part B. Now there's 20% left over, so let's look at the bottom half of the screen now and look at what is offered by private insurance companies to supplement Medicare. So we're going to actually just pretend now that there's a fork in the road. I want you guys to just imagine there's 2 major options you can go with for your health care alongside Medicare. So the first option you could choose would be here on the screen, numbers 3 and 4. In this case, you would have Original Medicare as your primary. When you have Original Medicare as your primary, that's going to give you nationwide access to any doctor that takes Original Medicare. All right? So you'll have nationwide access. You would have a Medicare supplement insurance policy. That would cover the other 20% that Original Medicare does not cover for most of the Medicare supplement plans. What makes these very easy to shop for, as we'll look at in a moment, they are all standardized based on their plan letter. So it makes it very easy to shop for these. Medicare supplement insurance does not cover your prescriptions. It's just designed to cover your medical. So along with that, you would have a standalone prescription drug plan. That's an insurance plan just designed to cover your medications. You'd bring that insurance card into the pharmacy to get your medications filled. All right, so that's option number 1 for your healthcare. Now let's look at option number 2, which would be the Part C Medicare Advantage plans. These can be complex, but to keep it very simple, here's how they work. It will be a combination of Part A, which is your hospital insurance, Part B, which is your medical insurance, and in most cases will include Part D, your prescription drug coverage, all bundled into one plan. Except here's the major difference. When you have a Medicare Advantage plan, the insurance company will now be your primary. So the insurance company will dictate your availability to doctors and what the benefits on the plan will be. And they're very different between insurance companies. So you want to do your research and make sure your doctors and your hospitals and your medications are all covered through the plan before you enroll into a Medicare Advantage plan. But let's take a better look. So now, we talked about a fork in the road. Here's the fork in the road. You can actually get a better visual at the two options you have for your healthcare. So option number 1 is to have original Medicare as your primary. You're going to have Part A, your hospital, Part B, your medical, which will cover 80% of your medical expenses, then a Medicare supplement policy to pick up your medical. This gives you nationwide access to any doctor that takes original Medicare without a referral. Then you would have a standalone prescription drug plan just to cover your medications. So that is option number 1. Option number 2 is a Medicare Advantage plan. This is the bundled all-in-one style plan. This is going to have your hospital coverage, your medical coverage, and in most cases will include your prescription drug coverage all bundled into one plan. All right, so when you have a Medicare Advantage plan, you're typically going to have a medical group assigned to your insurance. And if you have an HMO Medicare Advantage plan, you'll have a primary care physician assigned to your plan. And you'll need a referral to see somebody outside of your primary care physician. But hopefully you have an awesome medical group. Okay, so first we took the helicopter's point of view of the Medicare system. We're going to zoom in now and look at each part of the Medicare system. So let's take a closer look at Part A, which is your hospital insurance. This covers you for your inpatient hospital care, skilled nursing facility, hospice care. It'll even cover you for limited home health care. As long as it's deemed medically necessary, you can have some coverage for home health care. And this is not a complete list of all the services through Part A. Now we're going to look at the costs associated with Part A of Medicare if you were in the hospital, but I want to point something out before we go through these numbers. If you have any secondary insurance at all, whether it's a Medicare Advantage plan or a Medicare supplement plan, they're typically going to cover your hospitalization. You won't actually pay the numbers you're seeing on the screen, but if you just took the government portion of Medicare by itself, you just had Part A, and you went into the hospital, then you would pay these numbers here that you're seeing on the screen. First, you would have a deductible. In 2025, the Part A deductible is $1,676. Then your first 60 days in the hospital, it's $0 for that benefit period. From days 61 through 90, it would be $419 per day. And from days 91 through 150, it would be $838 per day in the hospital. Now again, a reminder, if you have any secondary insurance, Medicare Advantage plan or a Medicare supplement plan, typically they're going to cover your hospitalization. But now let's talk about the skilled nursing section. Typically you would be admitted into a skilled nursing facility after 3 nights in the hospital. They would admit you for more extended care at that point. With the skilled nursing facility, Part A covers your first 20 days at 0 expense. From days 21 through 100, in 2025, it's $209.50 per day in a skilled nursing facility. Now, if you have a Medicare Advantage plan, they might cover all or a portion of that $209.50 per day. If you have a Medicare supplement insurance plan, typically they're covering you at 100% all the way through the 100 days. After day 100, from days 101 and beyond in a skilled nursing facility, that is Medicare's gap. That's where the coverage stops. So then the costs would go to you as the patient, and that's typically where we start to have a conversation called independence planning, looking to plan for bridging the gap, covering your out-of-pocket expenses when you are beyond Medicare's limits. We covered Part A of Medicare, your hospital. Now let's go over Part B, which is your medical insurance. Part B covers you for your doctor visits and your preventative services, outpatient surgery, diagnostic screenings, emergency care, even durable medical equipment. Things like wheelchairs, canes, walkers, etc. are covered through Part B of Medicare. And this is not a complete list of all the services available. Generally, 80% of your medical expenses are covered through Part B of Medicare. All right, so now we're going to cover the premium for Part B. I'm sure a lot of you have been waiting to know what is the actual cost of Medicare. So Part B has a premium, and they're going to base the premium in 2025 on your income in 2023. They're going to take a look at your tax return, and this will reset every single year. They're always going to be looking backwards 2 years at your adjusted gross income to determine what your Part B premium is. So Medicare is going to use what's called your MAGI. It's your modified adjusted gross income. That's going to include your AGI, your adjusted gross income, and tax-exempt interest income. So part of the calculation will be interest, dividends, capital gains, rental income, and tax-exempt interest. All of that together will lead to this page that you're seeing on the screen. On the right-hand side, we've highlighted the premiums for Part B of Medicare. On the left-hand side, these are the income brackets. So I'm going to explain this, and what I want you guys to do is pause the screen. If you have a notepad, take out a pen, and I want you to write down your Part B premium for this upcoming year. So the base premium for Medicare Part B in 2025, it's $185. But again, it's based on your income. So you really want to take a look at the charts on the left-hand side. If you file taxes jointly, yourself and your spouse, if you made $212,000 or less in 2023, then you're going to be at the base premium, which is $185. If you file taxes as an individual at $106,000 or less in 2023, then you're going to be here at the base premium, which is $185. If you made anything above those amounts in 2023, then you could have an increase to your Part B premium based on your income. So now, let's give an example. Let's say you and your spouse in 2023 made between $266,000 and $334,000, then you would have an increase to your Part B premium. You would pay $370 for Part B, and you would have an increase to your prescription drug plan premium of $35.30. Now, why is this so important? When you are looking for health insurance plans, you really want to know your total healthcare costs by understanding what your Part B and potentially Part D premiums are for the year. So I want you guys to take a moment, pause the screen right now, find your Part B premium, and write it down. Unfortunately, with Medicare, they do have late enrollment penalties. So we're going to break those down. Let's start with the Part B late enrollment penalty. Here's how the penalty works. The monthly premium for Part B may go up by 10% for each full 12-month period that you could have had Part B but did not enroll. And with any of the penalties that Medicare assesses, they are permanent once they place them. So avoid a penalty at all costs. Make sure you sign up for Medicare in time. And we're going to be going over the enrollment periods towards the later end of the presentation, so stay tuned. Now we're going to break down the Part D late enrollment penalty. This is your prescription drug coverage. If you do get a penalty, here's how it would work. The penalty would be 1% of the national base premium, which is $36.78 in 2025, multiplied by the number of full uncovered months you were eligible. Again, this is a permanent penalty once it's assessed, so sign up for Medicare Part D in time. All right, you guys, now just to recap some of what we've covered earlier, original Medicare, that's Parts A and B, generally cover 80% of your hospital and medical expenses. Here's some of the things that original Medicare does not cover. Things like your deductibles, co-pays, co-insurance, outpatient prescription drugs, healthcare outside of the United States, and then also things like dental, vision, hearing, chiropractic, acupuncture, transportation, podiatry. These are things that are generally covered through the private insurance companies, not through original Medicare. Now, speaking of insurance, let's cover the first option we went over at the beginning of the presentation, which was Medicare Supplement Insurance. With Medicare Supplement Insurance, it can cover you for things like your deductibles. Depending on the plan, it may have no copay at all, and it covers your co-insurance, the other 20% that original Medicare does not cover. One of my favorite perks about this type of insurance, it gives you freedom to choose from any Medicare-appointed doctor in the United States without a referral. And what makes these very easy to shop for, they are all standardized based on their plan letter. It does not matter what insurance company it is, as long as they offer Medicare supplement insurance, they have to offer the exact same benefits across the board. Just make sure to find a credible company at a competitive rate, because the only difference between these plans really is going to be the monthly premium that you're paying, which is based off of your zip code and also your age in some cases. Okay, so now we are looking at the Medicare supplement insurance chart. And we've highlighted in yellow the two most popular Medicare supplement plans, the Plan G and the Plan N. And on the left-hand side of your screen, highlighted in gray, these are all the benefits we just talked about earlier. Part A, which is your hospital coverage. Part B, your medical, blood work, hospice care, skilled nursing facility. Part A and Part B deductible. Part B excess charge, I'll explain what that means, and foreign travel emergency for any of you travelers out there. So let's break down these benefits. The Plan G, it covers you at 100% of all the benefits we went over earlier, but you'll notice there's one box missing, which is the Part B deductible. The Part B deductible in 2025 is $257. After you've met your deductible, you essentially have 100% coverage and even 80% for foreign travel emergency. Now let's take a look at the Plan N. It's very similar. One of the major differences between Plan G and Plan N is the premium, the cost of the insurance itself. But I'm going to point out a couple key factors. Plan N is very similar. There's two boxes missing. One of these boxes is the same Part B deductible, $257 in 2025, but another box missing is the Part B excess charge. What a Part B excess charge is, that's when a doctor can bill an extra 15% over Medicare's approved amount. So let's just say you go to the doctor and it was a $300 visit, they can bill an extra $45. That's 15% as an excess charge. The Plan N does not cover the excess charge, but the Plan G does. Now another difference I want to point out with the Plan N would be under the copayment section. You might notice there's 3 small stars under the copayment section. With the Plan N specifically, you can have up to a $20 copay for some doctor visits and up to a $50 copayment for some emergency room visits. So as I mentioned a second ago, one of the differences is the monthly premium between the Plan N and Plan G. The premium for Plan N, typically, depending on your area, is less than Plan G. However, there is no coverage for the excess charge. There also may be copays. If you go to the doctors often and you're paying a copay every time you go to the doctor, then the difference in the premium might be made up by the copays you're paying. So that's something to keep into consideration as you're shopping for these plans. All right, as a reminder, Medicare supplement insurance, it does not cover your prescription drugs. It's just designed to cover your medical. So to cover your medications, you would do that in one of two ways. If you get a Medicare supplement policy, chances are you're going to get a standalone prescription drug plan. That's an insurance plan just designed to cover your medications. If you're going with a Part C Medicare Advantage plan, you'll typically see that your prescription drug coverage is integrated inside of that plan. Now, to have Part D in general, you must be enrolled into Part A and or Part B of Medicare, and you need to live within your plan's service area. All right, you guys, now we've come to what I consider the most complex part of the Medicare system, which is the prescription drug coverage. This used to be 4 stages to the prescription drug coverage, but there was a giant change that happened to prescription drug coverage in 2025. So let's break this down. You have stage 1, which is your deductible for your medications. That is essentially what you pay before the insurance kicks in for your medications. This may or may not apply to you. Some insurance companies will elect to use the maximum deductible. Some will have no deductible at all. The deductible in 2025 for medications is capped at $590. Again, it may or may not apply to you. It also depends on the prescriptions you take. If you take preferred generic medications, sometimes they can be considered deductible exempt. So even if your plan has a deductible on it, you still might not pay into your deductible. So that is stage 1. If it does or does not apply to you, it depends on the plan and the medications you take. Stage 2, this is where most people are. This is your initial coverage, your standard copay when you go to the pharmacy or coinsurance. Most insurance companies are going to have a tiered system. Tiers 1 through 6 in some cases. Tier 1 and 2 medications, those are going to be your preferred generic or generic medications. Tier 3 and above, those are going to be your brand name medications or your high retail cost medications. All right, now let's break down the big change that happened in 2025. There used to be something called the coverage gap, also known as the donut hole. And it's not as sweet as it sounds, because during the donut hole, you used to have to pay 25% of the retail cost for your covered drugs during that time. They've eliminated the donut hole in 2025. Now you have 3 stages. Once your maximum out of pocket for your medications, that means what you pay at the pharmacy, once you've hit $2,000 for the year for your medications, now you go into stage 3, which is catastrophic coverage. And once you get into stage 3, you will have no copayment and no coinsurance for the rest of the year. So if you get to $2,000, you now have a limit. That is the most you will pay for your medications. That was a big change they announced in 2025, you guys. But make sure to do your research on your plans before you enroll, because the coverage can change widely between the insurance companies. So now I'm going to cover some things you want to be aware of in 2025 when it comes to your prescription drug coverage. One, you have that $2,000 max out of pocket. That is a big change they made. But one of the things that you should know, that cost now got passed to the insurance companies. So once you hit the $2,000 mark, then everything above is covered by the insurance company. Because of that, there's been some changes in 2025. We've noticed that some insurance companies have said, we're going to leave this area. We're not offering prescription drug coverage in this area. Or they've said, we're just going to increase the monthly premium to make up for the cost. But there's still a lot of great insurance companies out there that maintain steady pricing and are still in the market. But you want to do your research before you enroll into a plan, because there's a massive difference between the most competitive and the least competitive. So pay attention to that. Now we've come to Part C, the Medicare Advantage plans. And if you're 64 and you're turning 65 soon, chances are your mailbox looks like it's going to pop right now. You're probably getting a lot of phone calls and emails. That is because a lot of the insurance companies are marketing the Part C Medicare Advantage plan, and for good reason. They're very competitive. Here's how they work. They're going to be a combination of Part A, which is your hospital coverage, Part B, which is your medical coverage, and in most cases will include Part D, or prescription drug coverage. Now, these are offered by private insurance companies. So you want to remember, if you have a Part C Medicare Advantage plan, the insurance company will be your primary. So if you went the other option and you had original Medicare and a Medicare supplement, that gives you nationwide access to doctors. The Part C Medicare Advantage plans, you're going to have a network. All right, so you'll have a medical group assigned to your insurance. You'll usually have a primary care physician also assigned to your insurance, and you'll need a referral to see somebody outside of your primary care physician, especially if you have an HMO Medicare Advantage plan. But there are some big benefits to having a Medicare Advantage plan, because you're going to have access to potential other areas of coverage now that original Medicare does not cover. So you're going to have your hospital, your medical, and your prescription drug coverage in most cases, but you may find there's extra areas of coverage that original Medicare does not cover embedded inside of these plans. All right, now we've come to a very important part of the presentation. We're going to cover the enrollment periods. And you have one big enrollment period when you turn 65, which is called your initial enrollment period. You're going to have a 7-month window when you turn 65. You'll have 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65 to enroll into Medicare without receiving a penalty. Now, before I go on, I want to point something out that's really important. If you're one of the people that has employer coverage, I'm sure that's a lot of you that are watching this. If you're in this wrestling match and you're going back and forth trying to decide if you should stick with your employer plan or if you should go on to Medicare, well, there's 2 questions you need to ask your employer before you make that decision. This is going to help you avoid any type of a penalty on Medicare. So the first question is, are you required to sign up for Part B of Medicare? Now, the second question, do you have what's considered creditable coverage through your employer? If you're not required to sign up for Part B and you already have creditable coverage through your employer, well, hey, you have the option. You can defer Medicare and join at some time in the future and stick with your employer, and you won't receive a penalty. But if you were required to sign up for Part B and you did not, then you could incur a penalty. So you guys, make sure to sign up for Medicare in time. And if you don't have employer coverage, follow the initial enrollment period. You want to make sure you get in within those guidelines. So after you're signed up for Medicare, every year after, you're going to have what's called the annual enrollment period. That's from October 15th through December 7th every year. This time period allows you to make Medicare plan changes, and you can make as many changes as you need to. The last change you make will become effective on the 1st of that following year. Now, why is the annual enrollment period so important? Every year in October, the insurance companies release their new benefits for that next year. So this is your opportunity not only to see all the new bells and whistles because the insurance companies are competing with each other, but this is your opportunity to make sure your doctors are still in network going into the next year and your prescriptions are still in the formulary and covered going into the next year. And you guys, if you get anything from this presentation today, two things I want to stress. Always, every year, make sure your doctors are in network with the plan and make sure your prescriptions are in the formulary and covered by your plan. That's going to set you up for success. Okay, so now we covered the annual enrollment period. Let's talk about the open enrollment period. A lot of people don't know this exists, but there is a time from January 1st through March 31st where you can make a plan change. It's different than the annual enrollment period. You can make as many plan changes as you want during that time. During the open enrollment period, you can make one plan change. And when you make that plan change, it typically becomes effective on the first of that following month. But it is there as an emergency blanket if you need it at the start of the year. Then that brings us to the lock-in period. From April 1st through December 31st, if you have a standalone prescription drug plan or a Medicare Advantage plan, you're locked into that plan typically through the rest of the year, unless you qualify for what's called a special enrollment period. These would be special circumstances throughout the year where Medicare will give you a window to make a plan change. We're going to cover a couple common ones here in just a moment. Now, if you're in California or some select states, you might have access to the Medicare birthday rule. That's going to be a 60-day window around your birthday where you can make a change, specifically a change with Medicare supplement insurance. And you could change from a plan with equal or lesser benefits. Why is that important? One, as we talked about earlier, the medical benefits are exactly the same. The only difference is the price. So you want to take advantage of that. Now, Medicare supplement insurance has medical underwriting. Now, what medical underwriting is, that's when you answer a list of medical questions on the application for the insurance. If you say yes to any of those questions, there is a chance you could be denied the coverage. So it's very important to apply for Medicare supplement insurance during a period where you don't have to answer any medical questions, such as your Medicare supplement enrollment period. That is a 6-month window when your Part B of Medicare is effective, or when you turn 65, whichever is later, where you can sign up into a Medicare supplement plan with no medical underwriting, and you can choose from any of the Medicare supplement plan options. As we pointed out earlier, there's a couple special enrollment periods I wanted to point out. Here's two. First one would be a loss of coverage. Even more common, if you were on an employer plan and you left the employer plan, guess what? Medicare will give you a special enrollment period to pick from any of your Medicare plan options in your area, whether it's a Medicare supplement plan or a Medicare Advantage plan. You're going to have options. Another common one, if you move to a new area, I'll give you a real life example. Let's say you're watching this and you live in San Diego County and you moved from San Diego County to LA County. If you had an HMO plan in San Diego, well, you just moved out of that service area. So Medicare will give you a special enrollment period to look at any of your Medicare plan options in your new area. For example, Medicare supplement insurance or Medicare Advantage plan. But the key thing to remember here, the special enrollment periods, these are other times during the year where you don't have to answer the medical questions. These are going to be considered usually guaranteed issue situations. Now we're going to talk about an often overlooked feature when you're shopping for Medicare plans, which is the star ratings. The star ratings with the Medicare plans, they're based on stars 1 through 5. And if you're like me, you might even be crazy and look at the comments and see what people are saying about the restaurant. Well, you get a similar opportunity with the Medicare plans. The star ratings are based on a lot of different factors, but a big one is member satisfaction. So you got to look at the prior member's experience before you enroll to the plan. So pay attention to the star ratings when you're shopping for plans. All right, I want to thank you guys for sticking around towards the end. This is my favorite part of the presentation. These are the consumer buying tips. If you guys are taking notes, write down some of these tips as you're shopping for Medicare plans. So let's start with Medicare supplement insurance. A really big tip is don't overpay. Because the core medical benefits are exactly the same, again, you want to find a credible company at a competitive rate. Another tip I want to point out, don't miss your guaranteed acceptance periods. Because Medicare supplement insurance in particular has a list of medical questions, take advantage of the times where you don't have to answer any medical questions. Maximize all of your discounts. I'm going to give you a few that you can write down right now. So one, if you agree to pay on an automatic monthly bank draft for your Medicare supplement insurance, some insurance companies will give you a discount. If you agree to pay for the whole year up front and you pay annually, some insurance companies will give you a discount. And the last one, probably the largest opportunity for a discount, would be called the household discount. That's when you and your spouse enroll with the same insurance company into the same exact plan. They're going to give you 5, maybe even 7% off of your monthly premium. It changes between insurance companies, so do your research ahead of time. And the last one here, check for extra benefits. Yes, the core medical benefits are exactly the same. Some Medicare supplement companies will have the ability to add on extra bells and whistles outside of their core medical benefits. So check for those inside of the plans. All right, next, let's talk about Medicare Advantage plan tips. Probably a lot of you are going to be looking at the Medicare Advantage plans. Rule number 1, always, every year, make sure your doctors and your hospitals and make sure your prescriptions are all covered and in network with your plan. And the last one here, review the plan's maximum out-of-pocket. 1, the prescription max out-of-pocket set to $2,000 for 2025. Pay attention to that, but there's also a medical maximum out-of-pocket. That would actually be the most you would pay as being a member of this plan. That's the maximum out-of-pocket. And they're going to range widely between insurance company. Some will be in the multi-thousands per year. Some are going to be in the low hundreds per year. So pay attention to the maximum out-of-pocket. Now let's look at the prescription drug plan tips. Chances are, if you're getting a Medicare supplement plan, you're going to get a standalone prescription drug plan. So here's tip number 1. Know your total annual cost. Because the prescription drug plans typically have a small monthly premium, it's very common to just look at the monthly premium when you're shopping for the plans, but you want to take into account what are your copays going to be at the pharmacy with that plan. Add your copays and your premium together so you know your total annual cost. Now, I told you I was going to talk about our technology. The tools we use here at Policy Engineer can actually calculate that for you in a matter of seconds with any of the plans that we're contracted with, so you know you're getting the best deal possible in your area with the plans we're contracted with. All right, now tip number 2, not all formularies are created equal. If your friend or your relative has a plan that they love, it doesn't always necessarily mean it's the best plan for you, because the formularies are different across insurance companies. So you want to find something that fits your needs specifically. The third one here, preferred pharmacy status, often overlooked. Insurance companies are going to have a list of preferred pharmacies. And if you go to those pharmacies to pick up your medication, you may find that you get discounted pricing at the pharmacy. And lastly here, use discounts and coupons when advantageous. Now this is not an ad at all. We have no affiliation with them at all. But I'm an advocate for something like GoodRx. That's www.goodrx.com. That is a website you can go to. You can enter in your zip code and the name of your medication, and it'll tell you if there's a coupon available at a pharmacy near you to get a discount on your medication. I'm a big advocate for saving money on your medications. All right, now I want to talk about our service to you at Policy Engineer. If we are lucky enough to earn your trust and work with you, then here's what you can expect with any of our licensed agents here at Policy Engineer. One thing is that we do multiple annual plan reviews. If there's an enrollment period coming, we want to be in contact with you. We want to make sure your doctors are still in network, your prescriptions are still covered, and you're taking advantage of all the areas of coverage available in your area. We do premium increase strategy calls. If you're paying a premium for your insurance, we want to help you shop the market by all means necessary. And then we have our dedicated customer service team. That is a Southern California-based team that will assist you with any of your tasks. Things like changing your bank information, changing your address on file. Maybe you got a bill you don't quite recognize from the doctor. Anytime you would call the insurance companies, you let us know. Our team can get involved and they can help you get these tasks done, so you just can be hands off. I'm very passionate about this. Our ever-expanding technology package. When myself and my brother, who's the other co-founder here, when we started Policy Engineer, we made a commitment that we would always have access to the best technology that is available, and we would stay ahead of the curve. This allows us and any of our licensed agents here to give you an unbiased recommendation purely based on your needs. All right? So now, if you're hearing me talk about this technology and you're saying, hey, this sounds pretty cool, I'm open to getting a quote, or I want to get an unbiased recommendation, here's some of the basic stuff we would need to enter into the tool to give you a quote based on your needs. One, we want to know when your Medicare starts. That's usually going to dictate when your plan starts. And hey, some insurance companies actually give a discount for being new to Medicare. That's a discount I didn't point out earlier. We want to know the zip code you live in because all of the availability to the plans, it's based on your zip code. If we know the primary doctor and any specialist you need to see, we can confirm that they're in network before you join a plan. And if we know the medications you take, we can pre-predict the cost ahead of time before you enroll into a plan and shop the market between all of the plans we're contracted with. And the last thing, if you're looking to maximize your needs, if there's a specific area of coverage that original Medicare does not cover, we can help you find that within all of the options available to you in a matter of seconds. All right, that ends the educational portion of the presentation. Thank you guys for sticking around towards the end. My name's Chris Franchina. I'm one of the co-founders here at Policy Engineer. And if you want more information, maybe you want help getting onto the Medicare system or an unbiased quote or recommendation, you can go to policyengineer.com. We have a ton of free resources listed there on the site. You can even book a call with some of our licensed agents. Hope to talk to you soon.